Congratulations, ma. I heard you had a baby a few days ago. Oh, baby, you look so beautiful. Ah, madam, did you notice that the eyes of this baby is yellow? The body is also yellow. This baby might have jaundice. Take this baby to the hospital immediately. Hi, once again. Welcome to another episode of Learning Everything About Jaundice. This is episode 3, and I am Nurse Angela. So today we are looking at the signs and symptoms of jaundice. How do you know that this newborn baby have jaundice? One of the things that you will use to know that this baby has jaundice is the skin. The skin, especially on the face, will start turning yellow. You know, the newborn is supposed to be pink in color. You know, when the newborn baby is pink, is fair, but not yellow. You know color yellow. That is how this baby will start looking yellow. And it starts from the face. Then it spreads to the chest, to the belly, to the arms, and to the legs. And it's most noticeable in natural light, like not in electric light. When you bring out this baby in natural light with under normal light in the room where there is a place that is well lit, when you bring out this baby, you notice that this baby is turning yellow. Another symptom is yellow eyes. The eyes, instead of being white, will turn yellow. The eyes will start looking yellowish. That's another symptom. Then another symptom that will know that, oh, this our newborn baby has jaundice is extreme tiredness. You know, we know that there are some baby that are not so active, but when you touch them, they grip your hand. When you turn, they have some milestones. They suck, they feed well, but these babies always look tired. When you carry the baby, when you hold the hand, there is no muscle tone, there is weakness. The baby sleeps a lot, very sluggish. When you are trying to wake this baby up, the baby is not responsive so much. It's not even interested in feeding. Another symptom is weak feeding. Normally, a newborn baby is born with sucking reflex. That is, they can suck naturally from birth, especially when you turn them to the mother's latching area. They can just open their mouth and start sucking. They have this routine reflex that when you even put your hand in their mouth, they want to start sucking. It is from birth. But this newborn baby is already extremely tired and refuses to suck well, refuses to feed. He's not even interested in breastfeeding or bottle feeding. You should be at alert. It's towing towards a symptom of jaundice. Another symptom that we know that, oh, this our baby has jaundice soon, is the urine. The urine will be very dark. Remember that this our baby is wearing diaper, yes? So when you check the diaper, it will have a kind of stain, a dehydrated stain, because the baby is not feeding well, the baby is dehydrated. And so as such, the pee will be darker than the usual light or clear color, which is for newborn. So these are some of the symptoms. So as a mother, these are some of the symptoms that you should, if you take note of it, if you go for a mugo, if you visit a friend, a loved one, a colleague, and you notice this thing, call their attention to them and take the child to the hospital. Another symptom that this baby might present with is light or pale colored stool. You know, the baby stool, after 24 hours, 24 to 48 hours, they pass out meconium, which is the greenish stool. And after that, they start passing their stool that is like, a goosey, yellowish, discolored stool. For this baby's own, is light or pale poop. The babies too are clay colored. The yellow is not very yellow. It is kind of clay colored, white or very pale, instead of the normal yellow yellow poop for the newborn, especially after the 2-3 days of life. So when you notice this with other symptoms that we are already outlining, you know that that your baby might be at risk of having jaundice, and immediately you take the child to the hospital. Another symptom is irritability. The baby cries a lot. Remember that these symptoms might not follow in accordance. The baby might present one of some of these symptoms. One of them, that's what we mentioned. Some of them can be extremely tired. They are very weak. They are extremely tired, very sluggish. Some of them can be very irritable. That is, they cry a lot. The child is very fusy, very hard to soothe. That this baby can start cry for 1 hour stretch. When you are giving the baby breast, will not suck. When you are trying to calm the baby down, the baby will not calm down. So another symptom of a baby that has jaundice is high-pitched cry. We all know that children, they wake up at night to cry, right? But in this case, when we say high pitch, the cry is unnecessarily loud for a newborn. This child can just wake up from the middle of the night and scream. It's called high pitch cry. That high pitch cry, when you hear it in your ears, it is like lightning in your ears. That is what we call high pitch cry. It's not like the normal baby's cry. It's very high with a sound. So when you notice that my baby is not The way my baby is crying, you check out other symptoms that might be related to jaundice before you can say, oh, I think my baby has jaundice. Another symptom of jaundice is aching of the body. So most times, although it can be very rare, if the jaundice is very serious, some of our mothers, they know all these things. So when they come for that omogo, when they start noticing this thing, they are the ones, because they are the ones batting the baby, assisting in the care of the baby while the mother recovers from the 9 months and the birthing process. So they know some of these things. They tend to see. So in this aching of the body, if the jaundice was not spotted on time, was not noticed on time, it can cause a backache or a neck ache that will make the baby to take a particular position. It's called kernicterus. This is very dangerous. That means the bilirubin has crossed to the brain and is now affecting the brain. We don't want this jaundice to get to this level. That is why we are bringing this awareness to first-time mothers, caregivers, colleagues on prompt response to jaundice. Another symptom of jaundice is fever or poor weight gain. So when we're talking about fever, the baby's body will be hot. And remember, mothers, first-time mother or a mother that has newborn baby, always have a thermometer in your house. It is very, very important. It is very, very necessary. So the baby might feel warm or not gain weight as expected if jaundice is affecting their health. Just like we mentioned, jaundice is breaking down their red blood cells, and as such, it's affecting their health. Please, when you notice some of these symptoms in this newborn, take the child to the hospital immediately. See you in the next episode.